Welcome to State of the State KS. My name is Rebecca Zepik, and today I'm joined by Jim Anderson, a candidate for the 4th Congressional District and former presidential candidate, Dr. Alan Keyes. Thank you for being with me.
Thank you. Glad to be here, Rebecca.
Dr. Keyes, I wanted to start with you. Last year's election seemed to be all about change, and my question is, what do you think this year's key issues are looking into 2010, and how do you think that Jim Anderson kind of answers that call?
Well, I think the key challenge we face right now is that Obama was about change, all right. He means to change the regime in the United States from a constitutional republic where people have rights and freedoms to a national socialist totalitarian dictatorship where we no longer have rights and freedoms. And that kind of change is being quickly implemented. And you can see it in the way he conducts his own business through czars. The term czar means Caesar, which is a word for a dictator. And the czar positions are positions in the office of the White House that are not subject to congressional oversight. And you turn over decision-making on hundreds of billions of dollars to individuals not accountable to the representatives of the people, who then go out and start dictating salaries in our industries, who start dictating the terms of credit, whether people are going to get it or not, and so forth and so on. And what you have is a dictatorship. So we've already moved down that road very rapidly, and now they're coming up with proposals like the health care proposal to give the politicians and bureaucrats control over life and death issues so that they will decide who gets health care and who doesn't get health care. So that instead of having a market system where it may require that you do some work and so forth and so on, but you'll be able to choose your doctor and get your health care. Now you'll have to go through a politician. Yeah. And if you're not in favor with the party bosses, they won't let you have health care, just like the old communist countries used to do. So that kind of change is occurring, and the key issue is, are the American people going to let their freedom, their liberty, their system of constitutional self-government be destroyed?
How do you think that Jim Anderson really sort of, you endorsed him, so what is it in his position and his message that you feel really answers what people are looking for then?
Well, the most important thing is that he represents a return to constitutional principles, respect for the Constitution, for limited government, for a government that truly represents the people rather than being in the hands of a dictatorial elite that then shoved things down people's throats. And that's what's happening. You know, you've got a majority of the people in the country saying no to government-controlled health care, but they're doing it anyway. The other thing that really attracted me is that he's basically just an ordinary citizen who stood up to run for office because he looks at what's available and says, that's no good. We've been allowing party bosses and money, and excuse my saying so, media personalities, to pre-select our candidates so that our choices are being determined by little cliques of elites. That's like the old Soviet Union. That's not the way candidates should be lifted up. Candidates should be lifted up by the people themselves so that on election day you're getting a real choice, not a phony choice that has been predetermined by a little handful of people who decide what the people are going to do. Because whoever determines the choices actually determines the choice. That was why Soviet elections were phonies. And that's why our elections are becoming phonies.
Yes.
Jim, I actually wanted to ask you a question about the health care bill that Dr. Keyes mentioned. It's now sitting before the Senate. And tell me a little bit about your reaction to either the House or the Senate bills before Congress.
I don't like either of them. I don't think either of them are good for the people. Neither are constitutional. The Constitution doesn't give them any authority to force us to have health care. The majority of the people in the country already have access to health care, over 90% of them. The bill that they have in the Senate right now is basically, with a public option, is they are forcing health care on us. People that don't want it, people that are happy with their health care bill or their plan already, that don't want what the government is offering them. And in my opinion, it is an assault on our liberty, an assault on our freedoms, and another way to control us. I don't believe it's about health care. It is not about health care. They don't care about our health. What they care about is control of the people. And they care about controlling our lives through health care, cap and trade, whatever you want. But the health care bill, in my opinion, should not even be there. It should not even have been passed.
Yeah, I was just going to ask you, what do you think? Do you think there need to be some changes in the healthcare system?
Well, there does. There absolutely has to be. But number one, I would say, let us go across state lines for health care. Remove the government. Get the government out of the way. Remove the rules, the regulations that are in place right now, and let the free market compete. Let the free market do it.
Dr. Keyes, you were part of the Reagan administration, and how have you seen government and I guess the American attitude towards government change over the past couple decades?
Well, to tell you the honest truth, I'm not sure the American attitude toward government has changed. The government has changed. It's become more and more controlling, more and more intrusive, and it contributes more and more to the problems we have. For instance, in the healthcare sector, analyses that have been done by very prominent economists starting years ago. I remember reading one by Milton Friedman in Public Interest, and that was back in 1998 or 2000. And basically he analyzed it so that you realized that, one, we already have heavy government involvement in healthcare through Medicare and Medicaid. His analysis showed that the cost push that is the major problem, the ever-increasing cost of healthcare, a lot of that is coming about because of the government role in those programs. You also have a contribution being made by lax government policy on immigration, where the overburdening of our emergency rooms and other facilities that are now being used by people who are illegal immigrants and therefore are not being covered regularly the way Americans are, is leading to unfunded costs that are then burdening the hospitals, and that is a burden that then has to be somehow passed on to those who are paying for insurance and who are covered. And so the costs go up. The tort issue, a government issue in which government has been lax about putting under control frivolous lawsuits that in fact are aimed at just money making. Lawsuits shouldn't exist to generate money, but to achieve justice and fairness. And so when you let lawyers get involved in the process in order just to make wealth for themselves, that's government laxity contributing to the cost push in healthcare. So we have a problem essentially created by the government, which now the government shows up and says it's going to solve. That's a lie. What it will do is cause greater problems, but what they will gain from it is control, so that in order to deal with those problems in the future, they'll just cut people off of healthcare. And they're already talking about the mechanisms, what have been called the death panels, things that will basically put in place a capacity to ration healthcare, to decide who's going to get it, and on the basis of formulas that the advisors who have been contributing to this healthcare plan have already gone on record saying that they are supporters of the approach taken in other countries that rations healthcare based on formulas that if you're getting older, the dollar spent on you isn't going to buy as many years and therefore will let you die. This is sickening, and I think it has deeply angered and dismayed people in America. The other thing I've noticed, though, on this issue and others, is one characteristic is government is no longer responding to the people. The people have said that they're basically against this health care, but they're pushing it through anyway. There have been vociferous opposition from people all over the country. They told them to shut up, and they're pushing it through anyway. Same thing happened with the bank bailout. Every survey I saw showed that upwards of 90% of the people in this country said no to the bank bailout. They didn't see any point in giving our hundreds of billions of taxpayer dollars to the very people who had caused the problem. And they went ahead and did it anyway. The same thing has been true of our immigration laws, where they've been pushing amnesty and not enforcing the law. And the people have been saying, enforce the law, secure the border, no amnesty. But they don't listen. So basically, government of, by, and for the people is, I think, a thing of the past in the minds of our elites. And we are becoming a society dominated by a little clique of elites who have the power and are now using it to dictate to the American people. And what Obama will represent is the formal establishment of that dictatorship as law, throwing out our Constitution, which he has said is inadequate. He says we don't need a Constitution that limits the power of government. We need a Constitution that gives government the power to do everything for people. Well, that's what dictators always say. And so we'll have a government that is no longer based on respect for individual rights, but is instead based on promises to do things for you, which give them the power to do things to you. And that power will no longer be limited by a Constitution that constrains them within the limits of respect for our rights. That's the change I've seen, and I think a lot of Americans see it the same way and are angry. They're worried because they like living in America. I like living here. I don't want to live in the Soviet Union. I don't want to live in Chavez's little dictatorship. I don't want to live in any country where the freedom and liberty of the people is not respected.
Well, I certainly wish that I had President Obama here to ask, because he was a constitutional law professor, and I'd be curious to see how he felt that some of his policies fit within the constitutional structure. But Jim, I wanted to ask you,